Hello everyone, welcome to another video. And today I want to talk about a very common mistake and a very common pattern that is seen among uh, radiology trainees, and they could be at any stage of their training. But it's very important for those who are starting their training or they are done with their mid exam and not now confused at what to do with the rest of the time they have left in training. So, most radiology trainees waste their first 2 years not because they're not working hard, but because they don't have a clear plan. So, in this video, I'm going to show you a smart study plan for the 4 years training. And in this way, you won't be just studying hard, but you will be studying smart and you will be able to prepare for any exams, local training exams, FRCR, or only if you want to be a very strong, confident radiologist. This roadmap can help you in that as well. So use this time wisely and make sure that you are doing your training properly without burnout. So, what happens is that the biggest issue is about confusion. There are too many books, too many resources, and radiology is so vast, and everyone has their own opinion about what to do, when to do, and how to do. So, at least knowing the things, or at least knowing how you can make time for these things in these 4 years, can save a lot of time and energy. So this is what happens that you sometimes start one book, leave it halfway, or sometimes just to read the book like very quickly, and at the end you don't even realize that okay, I once read this book maybe. So this is not useful at all. You're wasting time, you're wasting energy, and you're not getting anywhere. So too many resources and no clear direction eventually leads to burnout and fades motivation. So what to do? Always keep a strategy of building, layering, and refining the knowledge. So make your basics strong first, especially focusing on the anatomy, x rays, and ultrasounds. Then layer it while preparing for your exams. And lastly, make a habit of pattern recognition through cases that you will be reporting daily in these 4 years. Because radiology is not memorization, it's basically a pattern recognition technique. So, coming up to first year, you enter, you are very energetic, you are very hopeful that you are going to use your time wisely, and you will be studying from day one. Most of the people think like this, and some just are confused that what to study and how to study. Well, actually, most of us are. So, what to do? Ideally, when you are starting training, anatomy should be your key focus, because if you don't know the anatomy, you cannot know the pathology. So giving some time to anatomy is crucial to be a good radiologist as well as passing any exam. Now that FRCR is in Pakistan, it's a good thing for Pakistani trainees, for Indian trainees, that we can start this pathway earlier and get done with our exams while doing our training, and get you can get 2 degrees by your 4 or 5 years training ends. So, when even if you're doing FRCR, then I have shared a detailed timeline about how to structure your preparation in another video. But briefly speaking, that requires your 6 to 8 months. And if you're not doing FRCR, even then you have to give 3 to 4 months to your anatomy. And don't just read it, link it with your CT/MRI cases that you will be reporting. And most importantly, start building your foundation for X-rays and ultrasounds. Because in many setups, in many training schemes, you will be expected to handle these ultrasounds and x-rays independently soon. So build your confidence early. So how to do that? There are some very good resources for x-rays and ultrasound. Well, the biggest resource we have is our YouTube videos and online resources available. But some people like books like me. So once that we're done with the thorough reading of at least one book, we feel more confident and more oriented. So these are some books. Unofficial Guide to Radiology. It has 100 cases, high yield cases. Second is A to Z of chest radiography. And third is Accident and Emergency Radiology Survival Guide. So you can pick any of these and start studying. And in this way, you can develop an approach, a systematic way to approach the X-rays. Secondly, we have ultrasound. For ultrasound, this is one famous book, The Requisites. There are many other, and you can study the online version and then choose for yourself whatever suits your aptitude. Just give it a read, ideally in your first year. So this is very critical, and in this way, it will make you confident, reduce your stress during calls, and this is something that many trainees ignore, and nobody sometimes guides you about it as well. that ultrasound and X-rays are your basics. You cannot miss this. So try to make it your priority in your first year. Now coming up to second hurdle, the biggest hurdle for some people, which is physics, because in our setups, no one teaches physics, and it is a crucial part of every exam, especially the mid exams, and it is a component of FRCR. So you need physics. You need to study it. So if you are doing FRCR, ideally try to do it in first or second year. You can do anatomy first or physics first. It's totally up to you, or you can take both together in your second year. But give it 6 to 8 months, and I have shared the detailed video already how to prepare for FRCR physics. But even if you are not doing FRCR, this will be a compulsory component in your mid exam. So for that, give it 2 to 4 months in 15 to 16 months of your training at the start of your training. Ideally with anatomy, or once you're done with anatomy, you can give some time to physics. In this way, you will have a orientation about the syllabus in physics and how the things work, how the image acquisition is happening. So that will help you in reporting as well as in clearing your exams in first attempt, and especially the intermediate module. So second step will be, after your basics, anatomy, physics, and everything. Second step is going to be building your radiology base, how to approach pathologies, how to study pathologies. So for that, as I always discuss in each of my videos, that you need one short book and one big book, and you need to consolidate your knowledge. And when you are starting early, you have a lot of time. So ideally, I recommend that within your second year, if you are doing FRCR, then after your FRCR 1, and even if you are not doing FRCR, then after you are done with your reading your anatomy, physics, and some X-ray book or an ultrasound book, or you can do these side by side, especially when you're not doing FRCR, but at least start your radiology books by your second year. Give yourself a certain time to cover a region and keep it simple. Just review the big books available and also the short books available to make an understanding of what is suitable for you. Do not just follow any advice or any book that is being recommended in your setup, because everyone has different taste, everyone has different way of understanding. So I highly recommend to reviewing at least 2 to 3 books before finalizing one, and then make a timeline. And as you will be appearing in your mid-training exam, before exam, try to read few regions from the big book with short book, and by the time you come up to your exam, allocate 6 to 8 months for focused preparation, in which you will be reviewing your short book with your MCQ practice books, and as much as of your big book you can study before this allocated time. That would be highly commendable. So do this, and I have already shared another video about this too. And always remember that radiology is learned at workstations, not just from books. So try to make that time and that experience as much as useful as you can, because that won't return. And now coming up to the last 2 years of your training, once you're done with your mid exam and now you are preparing for the final stretch, and you may be taking FRCR 2A, then now is the time to cover up the rest of the book with your short book and annotate that short book heavily. That's going to be your ultimate revision tool. So go deep and complete. Just complete your reading and make good understanding, and make use of YouTube videos, online resources like Radiology Assistant, Radiopedias, and in this way, just try to consolidate whole syllabus for at least one time before diving into the final exams preparation. And in this way, you will be or preparing for FRCR 2A as well as your exiting exam. So, what other things that you must be adding while reviewing your books in the last 1 to 2 years? This is now the final exams will also be about the vivas. There will be case-based discussions. There will be OSCE-based questions. So you need to have a solid grip on cases as well. So these are some very good resources to follow for building your eye. Now, case-based books are Chapman's A to Radiological Differential Diagnosis. There's a book called Top 3 Differentials. Then we have Rapid Review of Radiology. There are Oxford's long cases for FRCR 2B, and then there are final FRCR 2B Viva Survival Guides. These are good books to review cases, how to approach a case, and building your library of radiology cases. Then there is a lecture series by Dr. Khan. These are basically for FRCR 2B, but I highly advise that every trainee should uh, follow this series. This is an excellent tool, excellent tool. There are some recorded lectures that are broadcasted on Saturdays and Sunday, and there are live sessions on Thursdays. The recorded sessions cover whole radiology syllabus in around 36 lectures, which are broadcasted every week. And in live classes, there are mocks of FRCR 2B. So try to follow these lecture series. These are really good for real case based learning. And lastly, when you're approaching the exam, do rapid revisions, do past papers. And if you are approaching doing a first year to it, then the ideal timeline would be at the end of the third year, at the start of the first year, fourth year. And in this way, you will be ready for your exit exam as well. And one last thing that I want to highlight and emphasize that this is the most important rule I believe that I am discussing in any of my video, that set strict timelines and stick to them actually. Assign fixed time to each system, and when the time is up, move on, even if it's incomplete. Because covering the entire syllabus once is better than mastering only half of it. And protect your last 2 3 months for whatever exam you're preparing, because you need that time to practice and revise. So always make a good timetable and cover the syllabus first. And if you are left with something, allocate some time at the end to cover the leftover syllabus, because all of us can get detract, all of us can have some emergencies. So always design your timetable in a way that there is some spare time, but you should not linger on one system and just keep studying that, like 1 page 2 page, and you are just studying, for example, one system in 6 months. That's not beneficial at all. So try to make strict timelines and stick to those. And again, radiology is pattern recognition built on practice. So practice, 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 see cases, report cases. And if you found this video useful, please like, subscribe, and share it with anyone who might be needing to get a better timeline for their radiology training, because the right strategy can save years of confusion. So do it for yourself and for anybody who might be in need. And next, I will be starting a series on X-ray basics and cases, and that will cover some X-ray famous X-ray books as well as some famous X-rays. So I hope that would be helpful for any radiology trainee at any stage of their learning and training. So stay tuned and take care. Bye bye.